Hello, and welcome to Documenting and Coding Developmental and Autism and Behavioral Screens. This is part of ACHIA's 2017 Early Screening Learning Collaborative. I'm Kaysen Benton. Today, our objectives are to learn the proper documentation needed for the screens, as well as to learn how to use the CPT codes. I have no commercial interest to disclose. So I recommend that you go ahead and print out the 2017 Early Screening Coding Chart. The link is listed below so that you can have that to follow along as we go over this presentation. And also, I want you to notice at the bottom of that chart, it gives you this important information, which is, as for this presentation, there is no guarantee of reimbursement. The information is accurate to the best of my ability as of December 2016, but I do recommend that you confirm all of the information you learned today with your payers. So let's start with the documentation. There are 5 components that you're going to need to document for your screens. The first is you're going to need 2 patient identifiers on the screening tool. And if the summary sheet is separate, you'll need the 2 patient identifiers there as well. You'll need the date the screen was completed by the family, the date the screen was scored, the provider interpretation and plan, and evidence of the screen in the medical record. So let's take the example of the developmental screen ASQ3 and show how this works. So you'll see here is one patient identifier. You have the patient's name. You also have her date of birth. And here you see the date that the ASQ was completed. Now there's a little bit of a problem here because you're not certain that this was the date that the parent completed the screen, or if this is the date that the provider scored the screen, or is it both? So I recommend that in your documentation you make it crystal clear what this date represents. And this is the overview sheet that you have on the ASQ3, and this is just a sample of the first sheet that the parents complete. The ASQ3 also has a summary sheet, and on here you'll notice that you do have the 2 patient identifiers, the name, the date of birth. You have the same issue with just one place to document that the ASQ is completed, but not really clear if it's the provider and the parent's date of completion. But also look at this. There's a little bit of a problem with the provider interpretation. If you look in this second section, you do see the results bubbled in, but down here it talks about interpretation, but there's no place for the provider to document that they agree that this is the way the summary sheet should be interpreted. So again, your provider should document either on this sheet or somewhere in the medical record how they are interpreting these results. Down at the bottom, there is a separate place to indicate your plan. That can be documented on the summary sheet. In this example, it's a non-provider who is going to refer to the primary care provider, but you'll see on there that there are options to bring the patient back and rescreen if they don't meet the cutoff for automatic referral, or you may go ahead and refer them to some of the options listed here. And then let's look at the ASQ social emotional screen. This is set up very similar to the ASQ3, but there's one difference in the summary sheet that works out a lot better. And that is, if you look in this area, the interpretation is much easier to document on the ASQ SE. It does have the same issue of only having the date that the ASQ is completed, but not real clarity about if that's the date the parent completed the screen and if that's the date it was scored. Moving on to the MCHAT documentation, you have the same 5 components that you need to take note of. But notice on this version of the MCHAT, you do have the name, but it says the age. Now, age is not a patient identifier, so you need to change that to date of birth to meet the criteria of having 2 patient identifiers on the screen. It also has the same issue. There's only one place for date, but you really need to know the date it was completed and the date that it was scored, which may be the same, but you need to document that. And there's absolutely no place for provider interpretation. Additionally, the MCHAT RF, it has a follow-up screen. So if your patients score between 3 and 7 on the initial screen, to increase the accuracy, you're supposed to administer this follow-up screen where you ask additional questions. And it's not required that this screen be in the chart, and you see there's really no place to enter the name, the date of the screen, the date of the birth. But if you are going to make this part of the medical record, you need to add these additional components. And then finally, for documentation, let's just touch upon evidence of the screen in the record component. And this is very payer specific. Some payers will allow you to just put in the completed summary sheet, and you don't have to keep on the ASQs all of those components that were put in by the parent. Other payers require you to keep absolutely everything. And then some payers really don't tell you what they want you to do. And if you'll refer to that chart, you will see the information I have, but there are a lot of gaps on what is needed. In doubt, I would save everything. So to review, 2 patient identifiers on the screening tool, and if the summary sheet is separate, on the summary sheet as well, date completed by family, date that it was scored, the provider interpretation and plan has to be in the medical record, and you need to have evidence of the screen in the medical record as stipulated by the parent, the payer. Then you have your CPT scores. For developmental screens, which in this collaborative are the ASQ3 and the MCHAT RF, you need a 96110. For your behavioral screens, you're going to use 96127. For your ICD-10 codes, for the developmental and autism screens, you'll use a Z13.4, that's Encounter for Screening for Certain Developmental Disorders in Childhood. And for the behavioral screen, you'll use the Z13.89, Encounter for Screening for Behavioral and Mental Disorders. As for modifiers, no modifiers are required for Medicaid, Blue Cross Blue Shield Alabama Healthcare Reform ACA contracts, or for all kids. Now you might need a modifier 25 on the E&M code for Alabama Blue Cross Blue Shield non-HCR ACA contracts, for United, and for other payers. And then the issue comes up about how many units or screens or tools can you ask for on the date of service. So for Medicaid, for your 96110s, those are the development and autism screening tools. You can get up to 5 per date of screen. Now, in this collaborative, you're only going to need 2. At the 18 and 24 month, you'll screen with the ASQ3 and the MCHAT, so you would put in 2 on those dates. And then if you're using the ASQSE in this collaborative, you can bill a 96127, and you can bill up to 2 per date of screen. Now, in this collaborative, you would only ever need 1. Now, for Blue Cross Blue Shield, Alabama, Healthcare Reform, ACA contracts, and for all kids, you just indicate the number of screens you administered. For the Blue Cross Blue Shield non-HCA contracts, United, and other payers, for multiple units on the date of service, you would put 96110 on the first line, and then 96110-59 on the subsequent lines. And then a slightly different thing that you need to be aware of is there are specific ages where you can administer these tools, and the total number of tools over the patient's lifetime may vary by payer. So for Medicaid, you can bill for these tools at the 9, 18, 24, and 48 month EPSDT screen But also at other times, if your surveillance raises a concern for a developmental delay or for autism. But for Blue Cross Blue Shield Alabama HCR ACA, for the Z13.4, that's the development and autism screen, you can only bill these codes in the age range between 90 and 30 months, and you can only bill a total of 5 tools. Now that's the right number for the recommended number of screens, so that should be sufficient. If you're doing the ASQ SE, for the Z13.89, you can do that anywhere from the newborn age up to 21 years of age, and there are a total of 31 units. Now, the reason there's so many is this code is used for more than social emotional screening. It's used for Vanderbilt's, depression screens, and other screens as well. Now, the ages and total number of screens for all kids is 8 to 36 months. That 8 month is nice because you do sometimes do a 9-month checkup at 8 months of age. They allow a total of 4 screens. And then just like the Blue Cross Blue Shield HCA contracts, they cover newborn to 21 years and up to 31 services. Alabama Blue Cross Blue Shield non-HCA contracts, United, other payers, there's no specific policy known. And in fact, if you go look at United's March 2016 preventive care reimbursement information, they don't mention a 96127, so they may not cover it as part of a well-child screen. You should reach out to them. So for our coding wrap-up, remember to include these 5 components in your documentation. We went over the CPT codes you need, the ICD-10 codes you need, the modifiers, the number of unit rules, and the ages of when you can use these tools. I recommend you keep that chart handy for reference and that you confirm any of this information with payers that you work with. So to complete this process for the CME, please return to Post-Test and Evaluation on the ACHIA website for this module. Thank you very much.